to the Putting the Public into Health podcast by Dr. Richard Pan. As we face one of the greatest public health disasters in a century, this podcast will address questions and issues from you, the public, about the COVID-19 pandemic and its impact on people's health and lives. I am Dr. Richard Pan. I'm a physician with a background in public health, and I'm proud to represent the people of Sacramento, Elk Grove, West Sacramento, and parts of Sacramento County in the California State Senate. I want to share with you important information and stories to help each other during this difficult time. Achieving community immunity, also called herd immunity, means that enough people are immune to a contagious disease so it can no longer spread. I am very excited and honored to have one of our nation's leading scientists join me, Dr. Peter Hotez, to talk about community immunity. Dr. Hotez is Dean of the National School of Tropical Medicine and Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine in Houston, Texas. He is an elected member of the American Academy of Arts and Science and the National Academy of Medicine and a leading science communicator battling misinformation about COVID-19 and vaccines. Thank you so much for joining me, Peter.
Thanks so much, Dr. Pan, for having me.
So, why is community immunity important to controlling contagious diseases like COVID-19?
Well, let's look at the situation, for instance, with measles. We know that, and I know this has been a big issue in California with terrible measles epidemics in 2014, 2015. Measles is so highly contagious that the only way to control it is with a vaccine. And once vaccination coverage reduces or goes below 90, 95%, you start seeing measles epidemics. So measles is so highly transmissible, you need a high amount of herd immunity, over 90%, to prevent transmission. With COVID-19, we don't know what the real number is based on its transmissibility. I think it's going to be pretty high level of either vaccine coverage or natural immunity, maybe upwards of 90%. Some modelers say 60 to 70%, but certainly way above the current level of herd immunity in the California population right now.
Now, some people are pointing towards Sweden, which is supposedly pursuing a strategy of letting COVID-19 spread throughout their population to achieve community immunity. Is this something that the United States should consider? What's going on in Sweden?
Well, I don't really understand the strategy of the Swedish population because this disease, COVID-19, is a pretty significant case fatality rate. Maybe as high as 1%, or some say even 0.5%. But, if you were to allow the population of California to become infected without social distancing, to allow herd immunity to occur through transmission of the virus, what's the population of California, Richard?
40 million
people. So,
yeah, almost 40 million.
So you're looking at the possibility of easily of 500,000 deaths in California. I don't see how anybody would find that acceptable.
Now, the World Health Organization has stated that there's currently no evidence that people who've had COVID-19 are immune to the virus, although they're not saying they're not entirely immune. But what does that mean for achieving community immunity, this uncertainty about the level of immunity after recovery from being infected?
Well, I think what the WHO is saying there is they are not prepared to issue certificates of immunity because they're uncertain there's a lot of uncertainty around it. I think what actually happens, if you look at what happens with the first SARS virus, back in 2003, you become infected, develop an antibody response, and then you're resistant to reinfection. And indeed, in non-human primates that were infected with this virus and developed an antibody response, they have now been shown through studies done in China that they're resistant to reinfection. So I think there's a pretty good likelihood that most people who are unfortunate enough to become infected with COVID-19 develop an antibody response and probably are resistant to reinfection. Now, there are going to be exceptions, especially those who with light infection or asymptomatic infection. Some of those will not develop a significant antibody response, and maybe they're still vulnerable. But most people who do get infected will develop an antibody response. I think that's how it's going to play out, although we don't know for certain. But on the other hand, right now it's not all that relevant to California. The percentage of people who've been infected with COVID-19 are pretty small, probably less than 10%, except in a few areas of extreme transmission, but overall, 90% of people in California do not have herd immunity, and so they're highly vulnerable to getting the infection right now.
Well, I certainly appreciate you mentioning that because some of the serology population studies have some people have pointed out, well, gee, in Santa Clara, they've found that maybe 85 times more people were infected compared to the actual positives, but also to point out that even with that, and I think some people raised some questions about that study, but even that study, if you take it at face value, still only reported 2 to 4% of people actually having had the disease, even at that supposedly high rate. And some people are also pointing to some of the like LA, sort of a similar type of finding. I think in New York they talked about some of the serology tests. Again, I think there's some issues related to the underlying studies that may be raised. They were talking about 20% of people getting infected despite having their hospitals overrun and their morgues filled with people who have passed away because of COVID-19. But certainly that seems like that's a pretty far distance from achieving community immunity if you're only at 2 to 4% or even 20% like New York.
That's right. Well, I think that's a good lesson right there. If you see, if you believe those numbers coming out of New York City, 20%, look at the devastation that 20% was linked to. It was linked to big surges on the ICUs getting overwhelmed, doctors becoming infected, a very chaotic situation. You can imagine what it's like if we were to just let things go and allow herd immunity to get up to 60 to 70%. It would be so profoundly destabilizing that I don't know that we'd still have a country after that. So that's not really an option for us. And one of the reasons why we're working so hard to accelerate a vaccine, but also why social distancing still has to be maintained in many parts of the country.
Now, there are some people going around claiming that, well, we're overcounting the number of COVID deaths. We're underreporting the actual number of people who got the disease. This is no more dangerous than the flu. What would you tell those people?
Well, we clearly know that it's much more dangerous than the flu. And remember how this works. There is a percentage of the population which is asymptomatic or low-grade symptoms, and they're the ones who are spreading around the community. But we do know that there's a group of individuals that are highly at risk. So we keep on hearing mortality rates of 0.5 to 1% for this virus. The true number is a bit meaningless because the truth is if you're in an older age category or if you have underlying diabetes or other comorbid conditions such as hypertension or renal disease or obesity, your mortality rate is 10, 15, even 20%. And that's bad news for those groups. And we still are seeing a number of young adults with no obvious risk factors getting very sick. So this is a serious virus, far more serious than influenza, which itself is a bad actor. So that's the reason for this national priority.
Mm-hmm. And although oftentimes people focus on the mortality rate, even for younger people, the rate of hospitalization is still fairly high, isn't it?
That's right. The CDC has not updated their numbers, I don't think. I haven't seen but at least a month ago or so, they were finding that about 20 to 30% of those hospitalized with severe illness were young adults between the ages of 20 and 44. So this idea that it's only a disease of grandma and grandpa or those with debilitating comorbid conditions is not necessarily panning out. And we're seeing some pretty serious disease that we haven't seen coming out of China, which includes a lot of severe clotting disorders, thrombotic events, things like pulmonary emboli, strokes, coronary artery thrombosis, and acute heart failure. So this is serious stuff.
So as an expert in virology, what would you recommend to elected officials like myself that we do to safely lift the stay-at-home orders? What are what should be our top priorities as leaders in government to try to halt this COVID-19 pandemic?
Well, this is tough. When you're trying to fight a virus, especially a highly transmissible one without a vaccine, it's like doing it with one hand tied behind your back. But one of the things that I've been saying is, there's been a lot of emphasis, especially here in Texas, about the economic recovery, and that's why we have to open up the state. And I get that, but the problem is it's being done before a time when we're going back into containment mode, meaning less than one case per million residents per day. So we're considerably higher than that already in Texas, and yet opening up. So that brings with it consequences, because I think if we do this prematurely, we're going to see a big resurgence of COVID-19 cases, which will then further destabilize the economy, unless we recognize that if to sustain that economic recovery, we implement a system of parallel public health. And by that, making testing for the virus in the workplace accessible, so that if you go into the workplace, it doesn't matter if it's a law firm or a Target or a Walmart, you need to know your colleagues are not walking around with asymptomatic COVID infection. And also in parallel, you want to have a system of contact tracers and that can identify not only the cases but the contacts of those individuals and get them quarantined or isolated. And they're starting that here in Houston, but the magnitude of it is still pretty small, so it's going to require hiring thousands of contact tracers. And then I think we're going to need a system of syndromic surveillance, and that in California, you're a bit ahead of the game, because you've got some of these West Coast tech companies like Kinsa, which is based in the Bay Area, run by Mr. Singh, who's really pioneered this system using an app-based system to Inder Singh. I was having trouble having a senior moment remembering his first name, Inder Singh, who has pioneered this concept of creating an app-based system to look for blips or increases in the number of people with COVID-19. And I think we're underestimating the importance of doing that kind of syndromic surveillance, and that's where America shines. We have that technological capacity. And finally, we need more granular models. I mean, the models coming out of the IHME, Institute for Health Metrics, go by state, but we really need them for individual metro areas, like where you are, Richard, in the Sacramento area or in the Bay Area. Oh, one other thing that I think is important is going to be a system of daily public health communications, and that's really important.
Yeah. Now, I know you've been a leader in preparation for pandemics for a very long time, and leaders like yourself in public health have warned us for decades to prepare for outbreaks of contagious diseases. How likely is another pandemic? I mean, we're in the middle of one, so I hate to bring up a future one, but how likely is another one, and what should we learn from this pandemic, the COVID-19 pandemic, to prevent future pandemics?
Well, this is our third major coronavirus pandemic of the 21st century. We had SARS in 2003, we had MERS in 2012, and now we've got this one. And this is going to be a recurring theme of major coronavirus pandemics. We need to learn our lessons. So one of the things that we're trying to advance is a universal coronavirus vaccine, so we don't have to make a new one every time. I think that's an achievable goal, as long as we can prioritize it as a country and globally.
Well, thank you so much, Dr. Hotez, for your time. I know you're very busy, both working on the science to help us get through this pandemic, as well as communicating to the public very important information for all of us to know as we are trying to get through this as well.
Well, thanks, Richard. You've been a pioneer in public health communications for so long, and thank you again for all your work you've been doing on vaccines and now giving attention to this issue.
Well, thank you. Thank you so much for listening to this episode of Putting the Public into Health by Dr. Richard Pan. If you have questions or ideas for a future podcast, please email them to senator.pan@senate.ca.gov. Please stay at home as much as possible, stay at least 6 feet away from others outside, wash your hands frequently, and try not to touch your face. Together, we are slowing the spread of the disease and saving lives. Thank you so much for listening.